Hello, the Johnson family. My name is Jayla, and I'm a community public health nurse. We all met earlier this week, so I do know some of you guys. Um, Today we're just gonna have a family focused educational session based on the comprehensive family assessment that we completed last week. So first, I just want to say, how are you guys doing? That's great. That's great to hear. I love seeing you guys. I do appreciate you guys joining the Zoom. I understand that you guys have a very busy life and everything. So I do appreciate you guys taking the time to sit down and talk to me as we discuss the results of the family assessment. Um, so before we get started, I just want to, does anybody have any questions or anything? No questions? Okay, great, great. So today's session is going to focus on promoting health, education, risk reduction, and disease prevention for the family. So once again, I do just want to take the time to just thank everybody for coming, and we can get started, okay? So I do want to just point out, I do have my results right here to the side of me, so you might see me looking back and forth. I just want you guys to know that that's what that is, so do not be alarmed, okay? Righty. Okay, so just a quick overview of the family. The family does consist of 5 members. That's correct. Okay. So I have down that the 5 family members are Mr. Johnson, Miss Johnson, LK, JJ, and GJ. Okay, everybody's name is correct? Okay, great. Just want to make sure that I'm calling you guys by the right names. So I don't want to get anybody offended or anything. Okay, so as we identified in our family assessment, LK, JJ, and GJ, you all are students. Is that correct? Okay, how's that going, guys? How's that going? Yeah. School is a lot. Yes, I do not miss those days. Okay. And so yes, I just want to make sure I have everything correct before we start diving into the education. You guys do identify as African American. Okay. And you guys are part of the Christianity faith. Okay, great. I just want to make sure knowing this information will help me tailor the education to you guys. So I just want to make sure that I have everything correct, okay? So during the family assessment that we completed about 2 weeks ago, we were able to identify some health concerns that are prevalent in the family. So we're just going to discuss some of those health concerns and then ways that we can manage them and prevent if any future issues with them. Okay? So a few of these concerns that we identified are mobility injuries, breast cancer management, asthma management, and vision changes, as well as injury recovery prevention. Okay? So, as we get started with the education, if there are any questions, please feel free to stop me and we'll get started. So, how I'm going to do this educational session, I'm going to talk to each individual family member about their health concern, and then we'll discuss educational ways to prevent them or just give more education about the disease. Okay? All right. So to start with, the first health concern that I have written down is mobility and injury recovery. I see Mr. Johnson and JJ, you both have experienced some injuries. Can you explain to me what those injuries were? Okay, correct. So Mr. Johnson, you had a torn ACL, a torn Achilles, and then JJ, you had the torn ACL. Okay. So first, I do want to say I apologize. I know that I might not have been a part of that, but I do understand that those are some pretty limiting issues, health concerns. So that I do understand how impactful those injuries could have been to you and the family. So I just want to extend my condolences for those. I do understand both of those injuries happen to our lower extremities, so it definitely does cause some issues when trying to get around and get to certain places. So yes, I do understand those limitations. what I want to discuss with you both is some educational points regarding recovering from your injury and regaining your mobility. Okay? So first, I want to educate you on following the prescribed physical therapy exercises given to you by your physical therapist. It is important that you guys adhere to the regimen because going to physical therapy can help you regain your mobility back, and it can help you prevent any further damage to your injury. By participating in physical therapy, it can help you get back to your baseline. So that is important because it's important. We want you guys to get better and get back to where you were at. Okay? I will say it is important in regards to your recovery. It is important to avoid high impact exercises such as running, jumping, jump roping, those type of things, because as we mentioned earlier, your injuries do affect your lower extremities. So by doing those, putting the high impact on them, it can potentially re-damage the injury or re-injure the injury, and prevent progressive healing. So it's important that you guys do some low impact exercises as well as physical therapy. An example of a low impact exercise could be swimming or stationary cycling, so that it'll help get the pressure off of your lower extremities, off of the injury, and it can help facilitate regaining mobility and strengthening that affected area. So doing low impact exercises, they can help maintain your strength, and it can help you without re-injuring your injury. Okay? Okay. Moving on to Miss Johnson. During our family assessment, we identified that you had a diagnosis of breast cancer that you're currently dealing with and going through treatment. So I do want to say, I want to ask, how are you doing with that? Yeah, cancer can definitely be a hard one. So a few educational points I want to give to you is that it is important that you continuously follow up with your appointments and your screenings with your primary care provider. Early detection is key. So going to get screened and just doing regular self breast exams, they can help in early detection and can help with the treatment of any cancer diagnosis or anything that you might have, like any health concerns in the future. Early diagnosis is key. I know that something that can help with your recovery is that just monitoring for any skin changes or any symptoms of breast cancer, like any new lumps that may appear, any skin changes to the affected areas or tissues, or any type of persistent pain. It is important that you do notify your healthcare provider if you do experience any of these, as they can help and assess you and get you back in to run some tests to make sure that nothing is progressing or getting worse. In regards to prevention, like I said, early prevention is key when it comes to cancers and any health concerns. So early prevention that we can do to prevent any breast cancer or anything is just doing a self breast exam while in the shower. It is important to do those about once every week as we get older, and just making sure to take time to self-examination each breast, and just going through and making sure and examining for any new lumps or lesions that may appear, as those can be indications for breast cancer. It's also important to get regular screening mammograms. Those can also help with early detection in regards to breast cancer or any other health concerns or cancers. So as we talked about earlier, I know that you said you were a part of the Christianity faith. So having support groups can help when dealing with life-altering diagnoses. So I can get you in contact with some support groups in your community that can help you talk about with other people and just discuss your feelings or anything with other people who might be experiencing the same things that you have experienced. So I do know there are some church groups in the community that I can send your way if you would like to get in contact with them. I can send them over via email to you guys. And I just want to say, like, having a support group, it can help you cope with the diagnosis. And I do highly recommend that you partake in them, although you aren't obligated to partake in them. I just do recommend them, okay? Mr. GJ Jr., I see that you were diagnosed with asthma at an early age, and so I just wanted to give you some education on asthma prevention and precautions to take to prevent any asthma exacerbations or flare-ups. Exacerbation is just a fancy word for a flare-up or an attack. Just some education regarding asthma. Asthma is prevalent within the African American community, so it is not uncommon to see more Black people have asthma. Ways to prevent a flare-up from happening in the future is just to avoid any triggers that may happen. Triggers for asthma include dust, pollen, smoke, or any strong scents in the house or outside of the house. Those can often trigger an asthma attack or flare-up. If you do happen to have an asthma attack or a flare, I would say that it is important for you to always carry your asthma inhaler, your inhaler pump. It's important to carry your inhaler pump with you at all times because you never know when an attack can happen. I also will be sending over some diagrams to just show you, just to remind you the proper way to use an inhaler, so that I know during an attack sometimes things get heightened. People, like, things happen really quickly, so just making sure that you educate yourself and know how to properly use your inhaler that can help during an attack and during a high stress time such as an attack. So it's important that you always have your inhaler and that you know how to properly use it. Ways to prevent a future attack in the home is to make sure that the home is clean and dust free, as those things can be triggers for an asthma attack. Another thing that I do highly recommend that you guys partake in is a family action plan. A family action plan is something that can help the family know how to treat or help with during a time of an attack. So yes, attacks can happen at any time. So just making sure that the family knows what to properly do in a situation where an attack does happen, that is important. So I do recommend that we all sit down and come up with an action plan that everybody knows, and that how everybody can help during a time of an attack. Okay, so I do recommend that we do sit down and do that at our next session, or you guys can start it now and we can talk about it and discuss it at our next session. But I do recommend doing that, okay? Okay. And then lastly, Miss LK, so I do see that you were recently diagnosed with presbyopia. I might be butchering that word, sorry. But it's also known as difficulty reading. As we get older, our eyesight does change, so it's not uncommon that people start to need corrective lenses and everything like that. I do see that you do have eyeglasses, so my first educational point would be to regularly go to your eye exams and do your eye assessments with your ophthalmologist or your eye doctor. It is important that you go about every year because our eyesight can change, and so by getting regularly assessed by your doctor can help tweak your corrective lenses if need be. It can help prevent further damage to your eyesight. I know during our assessment you did say that you like to read in the dark, so that could be damaging your eyesight in a way. So I would just say, whenever you do plan on reading or doing anything, make sure that there's adequate lighting that can help prevent any damage to your eyesight. So just making sure that there is adequate lighting, because reading in the dark does put stress on your eyes. So just relieving that stress can help slow down any damage that happens to your eye. Okay. So I know that was a lot of information. I know that was overwhelming. I will be sending over some pamphlets and some just educational tips in writing to you guys, so that just in case if you forget that we do what we talked about during our session, that you guys do have the information in your possession. I just want to ask, are there any questions before we wrap up? Okay, so no questions. So once again, I do appreciate you guys for sitting down and talking to me today. I do understand that this was a lot. So yes, I do say take time. You can reach out to me if you do have any questions regarding anything that we discussed today. I'm always here, and you guys do have my contact information. And yeah, so I hope you guys have a great day. If you need me, you can always reach out, and I look forward to hearing from you guys.